So, hello and welcome, listeners, to our exciting episode of our podcast. Today, we have a very special guest joining us to explore a topic that is the intersection of innovation, healthcare, and global travel. And we'll be talking about the future of medical tourism. Just to give an idea about the medical tourism, it involves individuals traveling to other countries to receive medical treatment outside their home countries. It is rapidly growing industry with patients seeking everything from elective procedure to life-saving surgeries in their destination around the world. And to learn more about a particular topic, ladies and gentlemen, I would like to welcome Mr. Mihir Vora, founder and CEO of Magnus Medi and SimplifyMVT. Mr. Vora, carrying over a decade of invaluable experience in a dynamic realm of medical tourism, Mr. Visionary leadership have been instrumental in the shaping the trajectory of medical travel, leveraging innovation and strategic insight to redefine industry standards. Beyond his role as a pioneering entrepreneur, Mr. Vora's influence extends to the governance level as a board member of a foundation of healthcare and wellness promotion of India, where his expertise continues to guide impactful initiatives and policies. Mr. Vora, we are deeply honored to have you and grace our podcast today, and we extend a heartfelt gratitude for sharing your time, knowledge, and expertise with us. So, without further ado, let's learn from the speaker itself. Thank you, Mr. Vora, for giving your valuable time, first of all. And here is my first question to you. Can you just give me an idea what exactly medical tourism for a broader audience in a simple way, and why the India is the fastest growing country in the particular segment?
All right. Thank you, Farooq, first of all, for inviting me on your podcast of Future of Medical Tourism. In a very layman's language, as you rightly said, that the medical tourism is somebody where a person is crossing the country border for medical treatment. While people talk about a country border, it is also about state borders. So somebody coming from MP to Maharashtra for a treatment is also part of a medical tourism. But broadly, it is international medical tourism where people travel from one country to another country for treatment for a various reason. It could be for a lack of availability of doctors or paramedics, or it is highly costly and it is not available on time. Right? There are a lot of places where you have a waiting time. So these are four broad spectrums where, because of these, people travel to another country. Okay. Second question of yours is why India is hitting is among the fastest growing nation among medical tourism. All right.
Right.
So you said in like you know that in COVID we were the city, we were the country who gave pharma to around 100 plus countries around the world. Right. We were the one who exported this Covishield medicines or vaccines. But having said this, we are pharma capital of the world. Similarly, we are the healthcare capital of the world because of the economies of scale, the healthcare experience that we have. We are growing faster than any other country in the world, in the specifically healthcare tourism.
That's so amazing. To means it's beyond our control. It's like India is booming in the every segment, we can say.
Oh yes, it is. India is going to be in the top 3 in very soon. I mean, we are still among top 5, top 10, but we would be the leader. There's a reason why we are not the leader yet. We will speak about it in the once we move ahead.
Yeah, sure. So now the second is, what are the major misconception when we say the medical tourism? For example, we know like the patient are coming. So is there any package or tour, something, some facilitator try to give to the patient, or it's only for they are coming to get the treatment?
All right. So first, you said about misconception, right? The misconception varies country to country. Example, okay? Just a second. I'm sorry.
Yeah, sure.
Yeah, so misconception is varies from countries to country. Like some of the Western countries today even think that India is a snakes and charmers land. While we have moved our healthcare from probably there will be article that you will see last month that we are at par with clinical outcomes, probably at par or better than US.
Correct.
Okay.
Correct.
So clinically we are far better. Clinically we are supreme in terms of as far as healthcare treatment is required.
Correct.
Understand that most of the people who travel abroad is for a tertiary or quaternary care. they do not travel for a primary or secondary care, right? Every country has their own primary and secondary care.
Right.
There are many countries who offer tertiary care, but they don't have doctors on time, they don't have paramedics, or it is very highly costly. So they travel to different parts of the world.
Correct.
Somewhere they travel because of the expertise that they want, right? That example I'm telling you that somebody from Africa travels to India for a robotic surgery is because of the expertise that India carries. Or
Absolutely.
somebody traveling to Thailand for a cosmetic is somewhere the perception in the cosmetics, they are far better, right?
Right.
However, um, you discussed about the packages that is offered to a user, right?
Right.
It's not always the case. The As far as India is concerned, we get a lot of quaternary care patients whose treatment plan changes on because generally on the basis of reports that is shared by the patient, the hospital or the doctor gives the opinion that this is what the likely treatment is, this is what the likely cost is.
Right.
But when they come to India, they have done the evaluation, and if the evaluation has any changes, then the cost changes, right? So it is not the fixed package always. But yes, there are some cases where you offer fixed package for knee replacement, fixed package for bypass surgery, fixed package for kidney transplants. All that is there, but it has still mild variations possible.
Got it, got it. So, अच्छा मिहिर जी, यहाँ पर एक क्वेश्चन मेरा है कि like every patient, for example, any patient coming from Africa, okay. So, what are the due diligence first they take? What are the primary steps which has been taken? उनका क्या हिस्ट्री निकाला जाता है वहां से और फिर यहाँ पर हॉस्पिटल कैसा चोजन होता है? So, you being in the industry for a long period of time, you know how the procedure goes, I guess. So it's like this only कि इसमें कुछ सेगमेंट और कुछ पैरामीटर्स चूजन होते हैं कि ये पेशेंट को लेना है, ये पेशेंट को नहीं लेना है.
See, understand, the patient who is traveling for a quaternary care or tertiary care treatment, उसने वहां पे अफ्रीका में they would have done their primary and secondary evaluation. उन्होंने डॉक्टर्स को मिले होंगे, they would have done initial diagnosis. On the basis of diagnosis, their doctor there in their country would have told them that, boss, this is a complex surgery. We will do it here, but it is better that you do there, or we don't have here. So better you go somewhere else. Now for them, for the patient, the option is open, whether they have to go to India, whether they want to go to Thailand, whether they want to go to Turkey or US or Germany, anywhere, right? Most of among all these destinations, India is most affordable, at the same time most experienced. Because of our population, our normal probably assistant doctor would have been a better experience than a senior consultant there at the other parts of the world, right?
Absolutely.
Because of the
No
economies
doubt.
of scale.
No doubt.
So they will share a report to us, and we will share a report to the hospitals. On the basis of report, there are some oncology cases which are in the 4th stage or a very advanced stage. On that basis, sometimes patient doctor says that, boss, there is no point calling them here. They will not get a fit to fly certificate for traveling from one part to another part. Better we give them a palliative care from there itself. But it is very rare. Most of the challenges will be accepted by doctor here.
Got it, got it. So we understand the point of this. What are the major challenges faced by when it comes to like आपको ज्यादा नॉलेज होगा कि इसमें ज्यादा चैलेंजेस क्या आता है, किस तरीके के पेशेंट्स को चैलेंजेस आता है या किस तरीके की ट्रीटमेंट को या फिर वीजा प्रोसेस, मतलब कौन से सेगमेंट में सबसे ज्यादा चैलेंजेस होता है व्हेन इट कम्स टू मेडिकल टूरिज्म?
See, again, as far as India is concerned, the major challenge is that we get patients from a different developing nations of, right? We are yet to get major patients from the Western or the European or the US patients, not in the numbers that we expect. But when you talk about developing countries patients, the major challenge for them is the fund. They may not have the fund to travel, right? Right. The second major challenge is how do they take it forward? Most of the time, when you are in the capital cities of that country, you know where to drive. But when you go to the rural areas, they do not know how to begin. There would be, in my journey, there are 50% plus patients who would have opted passport for the first time. So imagine somebody traveling to another country, they don't have passport yet, so they've never traveled abroad. In
Correct.
India, when we talk about abroad, we talk about leisure, right? I want to
Right.
go Dubai for holidays.
Right.
But when you talk about holidays and healthcare, it is wide difference. So
Right.
the challenges here are they worried about their language barrier, they're worried about their funds, they're worried about their how to proceed visa, how
Right.
would be a doctor, who would pick me up from the airport. A lot of questions in the patient's mind.
Correct.
These
Correct.
these are these are answered by companies like us, companies like Magnus Medi, which gives them complete assistance from point A to point Z.
एब्सोल्युटली एब्सोल्युटली एंड अभी थोड़े दिन पहले आपने आपका ऐप भी लॉन्च किया है सिंप्लीफाई एमवीटी राइट so yeah
Yes,
so yeah so can you just tell me it's a first app I would say like in a particular segment जो इतना clarity में मुझे देखा था तो मैं I was doing a research on a simplify MVT app and वो मेरे को बहुत क्लियर लगा कि ये सर्जरी है ये सर्जरी का ऐसा है ये सारे हॉस्पिटल्स है सो और फिर मैं उसको कॉम्पिटिटर भी ढूंढने की कोशिश किया बट मुझे सिंप्लीफाई एमवीटी जितना इतना लगा नहीं सो कैन यू जस्ट टेल मी मोर अबाउट इट द प्रोडक्ट the app I want to know and the audience
sure,
should know.
sure. So MVT stands for medical value travel. While larger audience around the world says medical tourism, in the India, government of India has said, please don't talk it as a tourism perspective. It is a value-based treatment, right? So
Right,
people are finding value in their healthcare, and that's why they are coming here. So it's
right,
called medical value travel. On that basis, I created a platform. It's a SaaS platform, which is Simplify MVT. It is a 100% B2B, which is useful for a doctor or travel people or somebody who's engaged in medical tourism abroad or in India, and a hospital who is giving a treatment, whether it is an Indian hospital or any hospital around the world,
got it.
to manage their query management. So it is, see, in one way, probably I have started in 2013, okay, 11 years back. But as far as I know, earlier it was only worried about quality of treatment. People used to say, I get a best treatment, it is okay. Now it is not that. People expect the service. So it is a combination of a treatment and service both, right? Although treatment is 60% important, but 40% service is important. Now, there is a lot of back and forth communication with patient, with partner, with hospital among the ecosystem.
Right,
Simplify MVT simplifies the entire query management platform during this journey.
perfect, perfect.
Yeah.
Sure. One more question over here. Like, it comes with it's a medical tourism. We know that's the fastest growing industry. How the government taking it seriously? How much government taking it seriously? What kind of healthcare provider responsive to the medical tourism, both domestic and international? How serious is the government when it comes to the medical tourism?
Okay, so government is extremely serious. Okay, this is the industry which brings forex into the industry in a large volume.
Correct.
As per the data given by government through FICCI, was that 1 in 6 foreign tourists (FTAs) are medical tourists. 1 in 6. Okay, that's
Oh,
huge.
oh,
Second is the revenue that one brings is equal to the another 5, right?
okay.
Third, uh, from the government of India, medical tourism is one of the 26 champion sectors that has been highlighted by the government of India.
Got it.
And most importantly, the government of India has launched two policies: Heal in India and Heal by India.
Okay.
These are the policies which is like on the broader tourism we had Incredible India. These is like specifically niche meant for medical travel. It is Heal in India, Heal by India. Heal in India is patient coming to India for treatment.
Correct.
Heal by India is whether it is treated virtually in some of the cases of homeopathy, in some of the cases of virtual consultation, or our doctors going to their country and performing surgeries there.
Okay.
So these are two broad terms that government of India has floated. So they are extremely serious.
Perfect. Got it, Mr. Mayor. So now the next question, like आपने एक government related budget, is there any budget allotted government की तरफ से on this for medical tourism?
Not specifically as in related to medical tourism, but yes, services export this comes under services export, and this comes under that. So, FICCI and SEPC both have certain budget to promote the medical tourism. So they are doing it their best, which could be in a decent number. But the government is doing a fantastic job. And if there is a specific allocated budget that we don't know yet, that is not in the open, that is not open to the public at the moment.
Noted, noted. अच्छा मेरे को ये पूछना था कि where India stands in the medical tourism as compared to the other countries. So we have a Western countries who are doing this, but India is most affordable in all these segments. So where India stands in this segment?
Okay, so if you ask me in terms of number of patients, we will be among top 10 or probably top 5. In among number revenue, we would be among top 10 because our revenue, even if we are higher by the number of patients, somebody's cost is so high that probably by revenue we will be among top 10 today.
Correct.
Okay. But the journey has already begun, and we should be among top 3 in next 3 to 4 years. Probably next 5 years, not more than that.
Okay, okay, that sounds amazing. In the next 5 years is very nearby only. We have a vision. It's
It is a fantastic opportunity at this time. When anybody who wishes to do medical tourism, they should join in now.
Oh, that's great. That's great. If someone wants to join, he or she can connect with you, right?
Oh, absolutely. Yes. SimplifyMVT does only same thing. So it helps new startups, old existing businesses, hospitals to maintain the process as well. So you can connect with me anytime.
So guys, यहाँ पर एक बहुत बड़ी अपॉर्चुनिटी है. मिहिर जी खुद बोल रहे हैं उनको ज्वाइन कर सकते हो आप. यहाँ पर वो अच्छी चीज है. ओके ग्रेट. सो अभी ये जो मेरे को ये जानना था तो कल्चरल लैंग्वेज बैरियर्स, तो इसके लिए स्पेसिफिकली आपकी कंपनी या जितने मेडिकल फैसिलिटेटर होते हैं ये इनकी कंपनीज में ये ट्रांसलेटर ऐसा कुछ उन लोग ऑलरेडी अपॉइंट करके रखते हैं?
Yes. So from Magnus perspective, we largely work with Bangladesh, Oman, and Africa. Okay. Africa, we don't have English, as an English it can be manageable. Okay. But for Oman, we have Arabic translators. For Bangladesh, we have Bengali translators. All right. So that is how we manage. But apart from that, there are people in Delhi, there are people in other parts of India as well, where they have Uzbeki translators, Kyrgyzstan translators. They used to have Pashtun, which Afghanistan used to send. Iraqi Arabic is there. So there are a lot of Iraqis, accent Arabic translators also there. So it is there. And even in Mumbai, if you talk, there is a French translators here. So the language barrier, we as an ecosystem definitely overcome.
So यहाँ पर एक बहुत अच्छी चीज मुझे सीखने के लिए मिली और जो ऑडियंस है उनको भी एक नया पोर्टफोलियो मिल सकता है कि इफ यू कैन लर्न अ फॉरेन लैंग्वेज यू हैव अ ब्रॉडर अपॉर्चुनिटी एक यहाँ पर भी है. एक स्मॉल आप यूथ को कोई मैसेज देना चाहोगे इसी मीडियम के थ्रू, सो दैट अभी जो अपना अनएम्प्लॉयमेंट रेट एकदम रेशियो एकदम टॉप पे है, एक स्मॉल मैसेज आपके थ्रू?
See, I would say, Farukji, if you know a different language, see, there are a lot of people who would know Bengali or Arabic, which is existing in our country as well. Okay. So it's a good opportunity for you. As well, you can connect with me as well if I can hire somebody. Okay. That's one. But if you can learn French, Russian, Uzbeki, Kyrgyzstan, so it has a bigger picture. So just to give you an idea of it, one hospital in Thailand has probably 30-40 Arabic translators. One hospital.
Amazing.
So, yeah, and it has to provide a service to somebody who is coming from that part of the world to give them anybody today. If you speak in mother tongue,
correct,
it eases out your communication, right?
Correct.
So that's where there is a good opportunity in this industry for translators are there. Apart from translators, even if you don't know the language, if you are interested in giving somebody or assisting somebody who's in pain, you have to understand what kind of questions, what kind of confusions these people carry. In our community, typically Gujarati, if you get admitted to a hospital, there will be 30-40 people there in the hospital to ask about you, to take care of the family. So attendants, if they're stuck anywhere, somebody will pay 50,000 rupees. That's not there for them. There are only 2 people they will travel.
Right.
There have been several cases where the child who needs a treatment, only mother can accompany them because they don't have money for the flight ticket. Now, if some youth here who thinks that they can make money and actually serve people, this is the place to be. Please join the
Absolutely.
healthcare revolution. So you help these people, poor people, or even a rich people who are traveling to a different country. You help them with a good cause and employed as well, get employed as well.
That is so amazing message you have given you. यहाँ पर मेरे को बहुत अच्छा लगा कि एक आउटपुट मेडिकल टूरिज्म के बारे में भी सीखने को मिला, प्लस एक अपॉर्चुनिटी भी है इफ यू समवन वांट्स टू जॉइन ए डिफरेंट सेक्टर, लैंग्वेज हो गया या सीखना हो गया, वो भी मेडिकल टूरिज्म सेक्टर को अप्रोच कर सकता है कि यहाँ पर काफी अपॉर्चुनिटीज बहुत सारी है. दैट्स गुड.
Yeah.
ओके, सो अभी मुझे ये जानना है, देखो व्हाट रोल डज टेक्नोलॉजी प्लेइंग शेपिंग द फ्यूचर ऑफ मेडिकल टूरिज्म. तो टेक्नोलॉजी का तो बहुत बड़ा हाथ है सब जगह पे. सो मेडिकल टूरिज्म में भी इतना फर्क पड़ा है
My
कि ये मतलब डिफरेंट सेगमेंट है, मेडिकल टूरिज्म कंप्लीटली डिफरेंट.
No, so my perception is if you want to scale, you need a technology, and that's a perception of many today.
राइट.
Okay, which I don't disagree with. The technology in medical tourism lies in multiple facets. Okay, one is a technology that is in the hospital. Hospital needs to have a technology which is all the equipments. I mean equipments which needs to be at par the best one, right? Today, India, we have Asia's only proton. We have many cyber knights. We have advanced CAR T cell therapies. We have robots. We have everything in the industry which requires. So that's one. We are, as a country, we are growing. The hospitals are investing a lot of money in technology.
Right.
That's one portion of it. The second is the doctor who is the artist. I tell doctor is an artist who is working on a patient. Now, if doctor is accepting the technology, long time back people used to say, doctor to हाथ से लिखेगा, उसका क्या जवाब होगा पता नहीं. Now doctors are getting used to type in the computers. Yeah, they're giving a written discharge papers. A lot of things have become eased out. They're using robots. It's not easy. When you study doctory, when you study your medical education, you are not treated on robots. Now these even senior doctors are accepting how the robots are working. So that's the adaptation of technology. Then the third part is service. Now, when the service comes in, you need to make the product accessible to everybody. You need to make treatment, the service, hospital accessible. That is where the technology will come in bigger picture. This will involve your virtual consultations, video consultations. This will involve your wearables. You wear certain things for a follow-up. Example, if somebody is gone with the treatment which requires a wearable to wear and measure their something, this will come into the picture.
Right.
Then you will have opinions, follow-up treatments, follow-up consultations that can happen here.
Right.
And then in my ecosystem, I have developed a technology for B2B, which is also there. See, not every technology is for the front end.
Right.
So my technology is for the behind. So if I can create a backbone which helps them serve more number of people in a better way, that also technology plays an important role. So I feel in next 5 years, looking at the last 10 years, last 20 years, what India has adopted a technology and they have reached to rural areas with the accessibility of internet now. I feel the other countries will also have that reach, and we will be as in technology will help people to reach out to a destinations. Right, the rural Kenya would now know because of the internet that yes, there is something existing in India for this treatment, right?
Right.
That will help find the treatment.
Ayurvedic, use the Ayurvedic treatment. Okay. So yeah, got it. So finally, what do you envision for the future of medical tourism and how the stakeholder work together to ensure it continued growth and sustainability on this segment?
Okay, so the topic was future of medical tourism, and that is where we were discussing it. I see the industry is growing more than 20% CAGR, which is in very few industries that happens. Okay, in the next 10 years from now, when I started in 10 years back, I thought that we are still in the infancy zone. The completely industry is unorganized. You don't know how many people are existing. There are no organized players.
Correct.
And I was telling people, I was telling my guys, I was telling my team that we are in the infant zone. 2019-20, I thought that yes, we are now getting on the runway. Okay, and then the COVID hit. The
Right.
entire COVID, the entire healthcare was working, but only healthcare travel was not working. So
Right.
everybody realized the importance of the logistics,
Right.
importance of the other aspects of medical tourism, right?
Correct.
Today, I will tell you again that we are still in the infancy zone, or we are on the runway,
Okay.
where we are about to take off as an industry. And next 10 years, you will see the India growing to probably a leadership position on the medical tourism. People from Western part, Australia, Japan, Europe, people will flock into the country for treatment. They will combine it with the leisure. Today, you see the India tops the chart for domestic tourism, right? People are
Right.
traveling left and center.
Right.
The same thing will happen where people want to travel for a leisure and then they will take Ayurveda, they will take health checkups, they will take treatments. Ayurveda is a hidden gem.
Right.
And that's invented by us. That's our proprietary right on
Absolutely.
it to the
No
world,
doubt. No doubt. No
right?
doubt.
So Ayurveda is something which will be part of a preventive care or a wellness, or even to a certain extent that now we have Ayurveda hospitals which can treat your disease, which is tertiary or quaternary care. Not
Correct.
all of them. Somewhere you have to have treatment done in surgical rooms, or you have to undergo the surgery. But there are lots of treatment, lots of ways where you can treat yourself with the help of Ayurveda.
Right.
So this combo of a traditional medicine like Ayurveda and the modern medicine like Ayurveda is nowhere in the world.
Right.
Nowhere.
Right.
So understand, today, post-COVID, the patient or the person, human being has evolved.
Correct.
They are more worried about their health.
Correct.
So like now it is easier to give preventive care as well.
Correct.
So this 10 years future is deadly combo, and India is going to grow and become a leader in the medical tourism. Mark my words, this is going to happen.
That's so absolutely true, absolutely true. And I agree, absolutely agree on this topic. So as we drew near to the end of the enlightening conversation, I want to extend my sincere thanks to our incredible guest, Mr. Mihir Vora, for sharing his wealth of knowledge and expertise with us. Your insight in the future of medical tourism have been truly invaluable, and we are grateful for your time and wisdom, Mr. Mihir Vora. And to our listener, I hope you found today's episode as enriching and thought-provoking as I did. If you enjoyed our discussion and found a value in the insight shared, we kindly request you to please support our video and subscribe to our channel for more informative content. And your support fuel our passion for bringing your engaging conversation and thought leadership across the diverse range of topics. So until we meet again in our next episode, please take care, stay informed, and continue to explore the world of knowledge with us. Thank you once again, Mr. Vora, and thank you to all listeners for tuning in. Until next time, take care. Thank you very much. Thank you, Mr. Vora.